of what do we need to do today. That also isn't just a daily thing, it's an hourly thing. You know, once we finish our assessment in the morning, the Chief Health Officer goes off and sits down with the AHPPC and has further discussions about what is happening nationally, what is happening internationally, what are people's concerns about risk going forward, what do they think that risk modelling is, what should we be looking for, what's happening with the sewage. You know, is that a sign that we're likely to have positive cases, the positive cases that are coming up? What are we seeing from that? What are we seeing with the new variants? What are we hearing internationally with the new variants? Do we need to be concerned of what's coming next? I mean, you know, what would they want us to release? Or would they want us to simplify that into a single sheet for people to understand? And then they'd be saying, but we want to see all the data behind that. You know, as far as planning and information and why some people... Look, I would like to know why the Commonwealth has an international cap but then sends double that outside of the cap, that they're sending just as many people in the cap as outside the cap on charter flights without telling us how many flights are coming in and how many people are on those flights, so that we can actually plan around our hotel quarantine capacity. Because if we don't want to have to say to people, sorry, we can't let you in, we can't let you relocate to Queensland right now because our hotel quarantine's full, we could actually plan better if the Commonwealth told us how many charter flights were coming in and when, and how many people were on it. And also told us how many people they approved to leave Australia every single day on international flights and then come back 6 weeks later in our hotel quarantine. Why are all these people leaving who are already here? We don't get that. I would actually like to know from the Commonwealth...
Order.
I would like to know how many vaccines the Commonwealth Government has on stock today. I would love to know. Oh, you know that, because they don't release that information. Not one person in this chamber knows how many vaccines, Pfizer or AstraZeneca, is currently held by the Commonwealth. And as many times as they've promised to release it, they haven't. But do you hear those officers going, where's the evidence of how much stock is on hand? Don't you love the wonderful announcements every now and then? Oh, we've got more stock. It's like, well, do you? Or did you always have it? Like, we don't know. We don't know. There's constant spotlight on us of what stock we've got and when we're delivering it, but do we know what the Commonwealth's got? No, we don't.